promotion is meant to be an effective means towards initiating and promoting individual and collective health actions with the aim of preventing diseases, improving the health and well-being of the citizenry, as well as ensuring a healthier society for all. Today on the program, we will be addressing the national health policy and strategy to achieving acceptable health standards for all Nigerians. Thank you for joining us. I am Lydia Odije Ochi. The National Health Policy and Strategy to Achieve Health for All Nigerians was promulgated in 1988, and it was the first comprehensive national health policy. It was acclaimed then to be a good policy document. Between then and now, many things have changed, and it has become necessary to review the policy to reflect current realities and trends in our national health situation. We know that the Federal Ministry of Health organized a review of that policy back in 1996 and 1997, but the revised policy was not formally endorsed. What stopped the endorsement at that time? We'll find out. It is on record that the first edition of the National Health Promotion Policy 2006 and the strategic framework for its implementation 2007 were developed to strengthen the health promotion capacity of the national health system. Questions naturally have come up on the review of the National Health Promotion Policy, and we have an expert to shed more light and give updates on this critical policy as a major step towards effective repositioning of Nigeria's health sector. Thank you for joining us. Today we're going to review and look at the health policy of Nigeria. And with me I have a health practitioner, Dr. Adebimpe Adebiyi. Thank you for joining us.
Thank you very much for having me.
We're delighted to have you come talk with us. Now, how would you examine or assess the evolution of health promotion in Nigeria over the past years?
I'll start with what health promotion is in the first place. Health promotion, according to the WHO, is the process of enabling the people to increase control over their health and particularly for improvement of their health. And arising from the first International Conference on Health Promotion held in Ottawa in 1986, there were specific strategies agreed on in the Ottawa Charter for health promotion. This includes advocate, enable, and mediate, meaning we must boost the factors which encourage health. We must also allow all the people to achieve health equity, and also governments must foster collaboration across all sectors. Health promotion is not just about the health of the body, but there are other factors outside the body that contribute to health. And actually, health promotion evolved in Nigeria, started with health education. And this was way back before that 1986, when the Federal Ministry of Health was still in Lagos. It was called the Health Education Unit in the Federal Ministry of Health. But later, after the Ottawa Charter in 1986, and up to 2006, the unit was redesigned to become health education branch. Of course, there was It underwent a lot of metamorphosis, which by 2006, we had the National Health Promotion Policy. The National Health Promotion Policy of 2006, of course, has been reviewed, and that is what has led to the current 2019 National Health Promotion Policy. And all of these policies or policy direction of governments they were actually born out of the recognition of the national health policy itself, the main policy, the national health policy, which recognizes that Nigeria has been saddled with the double burden of communicable and non-communicable diseases. How do I mean? Before globalization, Nigeria or Africa, so to say, we were battling with communicable diseases. But with globalization and modernization, a lot of things have changed in our environment and our diets. You now have non-communicable diseases, burdening us. And that has actually called for a lot of policy change in health promotion. Remember, I said we are working in line with the Ottawa Charter, which is talking about mediation of all stakeholders, bringing all stakeholders together, collaborating to foster health, the health of the people.
Okay, doctor, if I may come in here, I want us to talk about the underperformance of these health promotion policies. Now, why have they not been converted into interventions for people to really feel the impact?
Yeah, actually, health promotion has to do with knowledge, attitude, and practice. Knowledge of the population about what affects their health, attitude of government and the people that are being governed, as well as the practice of the populace. We have a lot of things that our culture do affect, our beliefs do affect. So all of these things can have a negative effect on the performance of the policies that government has actually developed. But the key factors that are responsible for the underperformance of the translation of the National Health Promotion Policy to intervention, there are many, but I will mention about 2 or 3. Number 1 is the poor prioritization of health promotion programs by government. If government actually prioritizes health promotion, of course, we know the benefits of sound health. We know the benefits of prevention. We know that prevention is better than cure, and it's even cheaper. Not just better, it is cheaper than cure. And health promotion is all of these, mainly talking about prevention of illnesses, diseases, or harmful practices. Also, there is a lack of ownership, poor ownership, lack of political will. And of course, that has led to poor funding, because where your mouth is, where your money is, your mouth will be there.
Thank you. Well, some Nigerians are of the opinion that non-prioritization of health promotion by the political class is a major causative factor, just like you said. Now, how can this be turned around, especially with this new administration?
Absolutely, there is non-prioritization, as I've said earlier. But health promotion actually deserves more resources than what it is currently receiving in terms of manpower, materials, and money. Very, very important. There is a lot of focus on curative medicine instead of preventive measures. We shouldn't wait till people get sick before we start to look after their health or their well-being. So government will be doing a lot of savings, making a lot of savings by prioritizing health promotion. And we can actually infer from the funding of health. In 2001, African governments came to Abuja and made a declaration that 15% of national budgets should be set aside for health. And if that 15% is actually injected into the health sector of this country, Nigeria, yes, every subsector will get its own bit. And if we now prioritize health promotion, the country will be better for it.
All right. Now, how would you rate the 2019 revised National Health Promotion Policy you earlier mentioned? How would you rate it?
I will rate that policy, not because I was directly involved in its formulation. I thank God for that. But I will rate it as one of the most indigenous policies that conform to the approved procedure for the development of promotion materials. And it is sensitive to religion, our culture, gender, name it. It was developed and conducted based on evidence, including accurate data and information across the country. It was actually approved by the National Council on Health, which is the highest policy-making body in Nigeria on health. There were a lot of field tests before the policy was actually finalized.
All right, ma'am. What should be the role of decision makers, managers, and service providers towards health promotion at various levels?
Actually, health promotion is a multi-stakeholder agenda. One, the decision makers have that responsibility to make informed decisions, to formulate evidence-based policies. And thank God we already have that. It is just for the managers to institutionalize effective supervision and monitoring and evaluation of the policy implementation. The managers are to act as thermometers to gauge the temperature of the performance of that policy as it relates to implementation. The service providers should ensure proper implementation of the policy. They should document the dynamic outcomes, because in health, we have emerging trends, and we should not rely on what was happening 10, 15 years ago. We should be able to analyze the outcomes of the implementation of the policy and then inform a rejig of the policy or a review, total review. The roles of the managers, the policymakers, the service providers must be to facilitate domestication of the policy, because it is one thing to have it at the national level. They must also ensure that it is domesticated at the subnational levels. There must be prioritization of discussions on the implementation, not that we just formulate the policy and dump it on the shelf, because there's no funding for the implementers to follow up with actions.
All right, thank you for that. Now let's talk about the human resources necessary to implement health promotion activities effectively and efficiently. Are we really up to that task?
I say no. I say no. We are not there at all. We are just scratching the surface. Mm. And I must say that we need to commit the required resources, not just resources, the required resources to the extant policies. As I said, we already have the policies on ground. We should learn lessons as we implement the policies. There should be continuous monitoring and evaluation that will show us where we need to rejig and recalibrate for service delivery, for capacity of the providers, and even capacity building for the policymakers themselves, because they too need to be aware of their responsibility. They need to even be, their capacity needs to be built for them to be able to formulate policies that will bring positive outcomes, not just for mere policy formulation's sake. There is grossly inadequate human resource across the 3 tiers of government in terms of quantity. Recall I said earlier that we were coming from education, health education. We are now in the era of health promotion. So there has to be that reorientation of even the providers themselves, the policymakers, everybody. And then for the providers, the quantity, the quality, and the mix. At these different levels of government or the country, we have responsibilities for the health promoters, health promotion officers at the different levels, at the local government level, at the state level, at the federal level.
Okay, now let me ask
you. We cannot give what we don't have.
Definitely.
We cannot give what we don't have.
That's true. Now let's talk about the brain drain, especially as it affects the health sector. How will this affect the implementation of policies, of these health policies?
We have been talking about health promotion. But if we go into health policies generally, I will say that we have a dearth of the policymakers, because yes, at the legislative level, they finalize the policies of government by, enacting laws. But all of this policy formulation has to pass through a process. There has to be practice that will be evaluated along with the enabling environment, and the effects will be analyzed. And before we can say we are formulating a policy, there has to be agenda setting. There has to be situational analysis conducted. What and what has been causing what, before we can now say, oh, this is where we will tackle the problems at hand. And so, with everybody jackpine, if I can use that word. Nurses, doctors, engineers, because we have biomedical engineers that work to ensure that our machines, our equipment work optimally. Mm-hmm. We have, even I hear that even health attendants are jackpine. So where do we go from here? If the health attendant is not able, if we don't have sufficient of them, how do we measure their contribution to health, effective health service delivery in this country? And we cannot formulate policy without all of this situation analysis being properly conducted.
Thank you very much. Now, the way forward. How can the national health policy become a formidable contributor to achieving the health-related sustainable development goals, as well as the universal health coverage?
As far as the World Ministry of Health is concerned, that is the WHO. Mm-hmm. Their priority agenda for achieving the sustainable development goals is by leaving no one behind. In fact, that is the mantra of the current Director General of WHO, leaving no one behind. And health promotion is a veritable tool in achieving this, because we have to institutionalize preventive measures to ensure that there is a good percentage of the vulnerable population that is healthy and well-informed about their health. They should take control over their health, over the improvement of their health. And health promotion will also become a formidable contributor if there is effective partnership, if we have multi-stakeholder buy-in and continuous support from all the tiers of government. Let it not be left to the national government or the federal government alone. It is the responsibility of everybody, including the media. Because if the policy is there and the media is not propagating the information to the Nigerian public, it will be as useless as anything that has been done. We have to have the regulatory bodies on board, the professional associations, the academia, because they do a lot of research, and research informs policy.
Thank you so much, Dr. Adebimpe Adebiyi. Thank you for being our guest today. We look forward to seeing more of your contributions towards national development on NIPSS Policy TV. Thank you indeed. We're grateful.
Thank you. Maybe you don't, you know I'm an MNI?
Oh, yes.
Oh. 2013.
Oh, we've been talking with Dr. Adebimpe Adebiyi, MNI, on NIPSS Policy TV. Thank you for sharing your time with us on the program. We really appreciate it.
Thank you. Thank you. I appreciate it.
Pleasure indeed. Thank you, ma'am.
Keep watching.
Keep watching.
Keep watching NIPSS Policy TV.
Making it increasingly difficult, because when you go to the hospital, they tell you materials are on the increase, drugs are on the increase, and it's not something that you can negotiate with the hospital management. They will tell you, no, you are here, you have to pay our bills.
Are you registered under NHIS?
No. No.
Do you have any healthcare, primary healthcare presence in your locality?
None.
What do you think the government should be doing in order to address this challenge?
Well, I think we have a Ministry of Health in the nation and in the states likewise. I think both the state and the federal should come together to ensure that every locality, every settlement has at least a primary care healthcare center that can be reachable within minutes in case there's an emergency. Yes. And where I stay currently, we don't have one close, except you go, it's maybe a drive of 10-15 minutes to get to the closest primary health care center. Yes, I think they should collaborate, both federal and state, to ensure that, because I think if I'm correct, a primary health care center is a place where you at least can have one or two nurses with drugs readily available to treat as simple as malaria. Yes, and it don't, for me, I don't think it takes much, because you don't need to build a structure. A room, I think a room and 2 rooms is okay for that to be kickstarted.
Are you aware of NHIS?
I'm aware, but I'm not part of it.
Why?
Why I have not registered?
Do you wish to register?
Yes, if I have the opportunity, I will do that.
Do you have a primary health care presence in your locality?
Yes, but I have in my locality. But one thing with those kind of primary health care, they are they are not so good to an extent that you have confidence in the doctors or the staffs working in those kind of places. If you look at the condition of those facilities, is something that you will not pray to fall ill and to be taken to those kind of environment, because it's something that government have neglected it.
What do you think the government should be doing in order to address these challenges?
I think what government should do in this country, issue of healthcare should be subsidized, or let me see, issue of healthcare should be free for a citizen of the Federal Republic of Nigeria. Why? Because that is the only thing we should be advocating for. That every citizen of this country should go to the hospital for free and should get drugs for free. It will really help, because that's the only thing for me. Health challenge is something that is natural for human beings, that you cannot do without, and it's part of life.
The government should try and improve the healthcare facilities. They should try and develop more primary healthcare, because these are the healthcare systems that are close to the community, at your doorstep. So the government should put priority on the primary healthcare sector, not looking at the secondary and the tertiary. Because when you go to the secondary, it is when case has gotten to a level of referral. And those cases sometimes are hard to get. But in primary healthcare challenges are cases that every day, that day to day in our life, in our community, we are always faced with those challenges. So why can't the government look at the primary healthcare at the grassroots, so that when the primary healthcare are being encouraged, trust me, the secondary healthcare will have no challenge. Yes.
Do you know about NHIS?
I know about NHIS.
Are you enrolled under NHIS?
Yeah, I'm enrolled under NHIS. NHIS are really doing well, but the challenges the people are having in relation with NHIS is, before you reach out to your NHIS facility, you must have faced a lot of challenge.
What are these challenges?
A situation where a pregnant woman is being enrolled into NHIS, and the NHIS is located in a community or at a distance where she cannot be able to access it immediately. Financial challenges will now come inside. And probably she's a pregnant woman on emergency. Okay, imagine an NHIS registered in a community like Barkiladi Orium, and somebody will have to come to Jos to receive a required medical attention. You know it's challenging. That is it. So it's challenging. So the NHIS is helping, but it's becoming challenging by the day. Yes.
What do you think the government should be doing in order to improve NHIS services? Do they cover for all
Keep watching.
Keep watching. Keep watching NIPSS Policy TV.
I have Rear Admiral A. Adesope, Chairman of the Game Planning Committee of the Crisis Game 2023. Now, sir, I want to deviate into you as being a former participant of the National Institute. What has been your experience so far?
Thank you very much. Okay, looking back, I came to the National Institute February 2015 as member of Senior Executive Course 37. And as fate will have it, I later became the Monitor General for the Senior Executive Course 37, 2015. And then by November, we graduated and were awarded the yellow badge, like the DG calls it, yellow badge. And I will tell you, I'm a proud alma mater of this great think tank, and I remain so. I remain grateful to the Almighty God for the great privilege He gave me to be a participant of this great institute. And it has been a wonderful experience, especially when I came here, I was green, about so many things. And then after passing through the Senior Executive Course, it has never been the same again. When I got back to after living here in November, I was appointed to the Naval Headquarters. And any paper I write and do, once they pass it on, they say, who wrote this? It's Captain Adesope. I'll go and call him. Where did you get this? I said, well, this is one of the teachings from the National Institute. The camaraderie among all distinguished MNIs. I can tell you that it's a wonderful, anywhere you are, I'm talking of the entire country, because after living here, I've served in different states. Once my yellow badge is on, somebody hug you. You're from the National Institute. I remember, yes. What do you want? What do you want? And they attend to you. So it has been a real positive experience being an MNI. So I'm proud to be.
Wow, that's good to know.
Yeah.
You talked about it being a very glorious or wonderful experience for you being an MNI.
Yeah.
Has it also paved the way for you in having access to government policies or influencing government policies?
Well, yes. Yes, because I've been a member of many committees, and I know that some of the recommendations and implementation strategies I've profiled have been implemented. Many of them. well, perhaps I don't want to mention them now, but if you want me, I can give you one or two examples. The Nigerian Navy Military School today, which is at Ikotwen in Akwa Ibom. I was part of the committee that sat for the establishment of that secondary school. I remember very well. I was the executive officer, that's second in command of the NNS Jubilee. That's our base, Nigerian Navy base Jubilee, which is at Ikorabasi in Akwa Ibom State. So that time the Nigerian Navy was given the opportunity to set up a secondary school. So the first instance was when the present Senate President, Senator Akpabio, he was a governor, when some of the buildings, we call it security village. I was a security village in Ikorabasi. We were given some buildings. Then I was the command intelligence officer that time. So when I went back the second time, I've done my course here, and I now went back as the executive officer. So I got to cut the long story short, I got to the base, and then the paper came that we need some buildings, we need to establish the school. So I just flashed back. I said, I was a commander, later Navy captain, when we were given this building and this one. I said, are you sure? I said, yes. So it's okay, take it up. So I went to the office of the secretary to the state government now, then, and the deputy governor. Immediately I entered the office of the secretary to the state government. He saw the badge. He said, officer, come inside. You're MNI? I said, yes. He said, my wife is an MNI. I'm telling you, sit down. What do you want? I said, look, this the place where the Nigerian Navy Military School is now was a former technical college. Yeah. So it was handed over to the Nigerian Navy. So I said, look, they've handed over this school to us and these buildings. This was a time, and I came here as an intelligence officer, and it was Akpabio that was there. That time it was Akpabio has handed over to the one that left now before this new one. So he said, is that it? He said, okay, no problem. Come back to Sude. Everything was done for us, and we got the certificate of occupancy and everything. The school is there tomorrow now. So that's just one. That's one. Numerous. Is it Abuja I want to talk about? Anywhere I go, once I wear the badge, I used to make that joke that, look, even in my pajamas, I put on my badge.
That's interesting to know. So, how does it feel? What nostalgic feelings do you have each time you come back to the National Institute? Because you said you have been part of, you had come back to be as a directing
staff, yeah,
and now as the coordinator and chairman of the Crisis Game Planning Committee. So how has it been?
It's homecoming for me. I'm actually proceeding on retirement. That's to be next month.
Wow.
From the Nigerian Navy and the Armed Forces. After putting on serving this nation for almost 33 years. So I'm leaving as Rear Admiral. When the notice of retirement came out, and so the DG called me and said, Admiral, this is what I have. I said, yes. I said, okay. Would you like to come back to the institute? I said, yes. So I'm back here now, so as a DS. I like giving back. I like imparting knowledge. And I'm happy when I see grown people when they come here. And then the next 11 months, they have become well modeled, and I believe they're going with a lot of knowledge to go and impact the bigger society in their different organizations. So it's good to be here, and I'm happy to be here.
So what should we expect going forward from you?
Like I told you, we're here to give back. There are so many areas I think we can improve upon on the senior executive course and other courses. God willing, and time on our side, we'll make positive changes in all the necessary documents that guides the senior executive course and other courses by the grace of God.
Oh, that's good. That's very good. Thank you for your time. It's good to know about your experience as a participant and now as a DS at the National Institute for Policy and Strategic Studies. Now we'll go back to the program. Stay with us.
The National Union of Journalists, NUJ Correspondent Chapel, paid a courtesy visit on the Director General, National Institute for Policy and Strategic Studies, NIPSS, Professor Ayo Motayo, and his management team to extend a hand of fellowship and to request for ways to encourage partnerships to foster fruitful relationship.
We want to thank you for opening your doors at all times to the media. We felt we can also seek areas of further collaboration. And so we'll continue to sensitize our members that instead of going the other way, we will seek better ways of collaborating and to ensure that if the Institute succeeds, we are also succeeding as Nigerians.
Welcoming the delegation to the Institute, the DG urged the Correspondent Chapel to use the power of the media for attitudinal change, promote leadership, skills, and capacity building.
I'm sure you have been relating with the Institute for a long time, and you know that wearing the yellow badge is not an easy thing. When I see people wearing the yellow badge, I always pay respect. My participants are fond of saying that DG, after your tenure, we want you to come and see how easy it is to wear that yellow badge. I say, hey, I'm not, I think I'm an old man, I've passed that stage now. There is need for what we call developmental journalism, need to report correctly what is going on in government and let government tell its own side of the story. I want you to be a partner with us, and I'm sure we will get somewhere together.
Professor Omotayo announced the launch of NIPSS Policy TV, which is aimed at creating awareness among Nigerians on policies, strategies, and their implementation.
We call it NIPSS Policy TV. Our problem is about our focus is on policies and strategies for implementing them.
He appreciated the management of the Nigerian Television Authority (NTA) for their support towards the realization of NIPSS Policy TV. Lydia Odidiochi for NIPSS Policy TV.
It is now my singular honor and privilege to invite the Director General of the National Institute, Professor Ayo Motayo, for his opening remarks. The DG, sir.
Thank you very much. I believe it is not 12 noon yet. Is it 12 noon? Oh, yeah. So let me say, I welcome us to a bright new day. I do not have much to say. I just need to make a few remarks. But before I start, I want all of us to stand up. Tell the person next to you, look at the person next to you. You must find somebody to face eyeball to eyeball. You can't be free. Find somebody. This is the way it's going to go. Come. It's not like this. Don't shake hands. You see, the first thing when you come to PSNC is that you must follow instructions, okay? Look at you must be facing somebody. You can't, I'm going to penalize if you are not looking at somebody's face. I'm going around, I'm going to find this lady. She can't find, okay, go to madam, yeah. You can't, it must be one-on-one, eyeball to eyeball. Madam, I'm going to find you. You have to find somebody. Maybe you'll find the cameraman. Can we borrow somebody? Okay, borrow this lady. Borrow her. Look, don't look at me. You are failing the instructions. I don't have business with you right now. Face the person you are with. Now, look at that person in the eyes and say, welcome to change. Welcome to change. Welcome to change. Welcome to change. I've never met you before, but all the same, welcome to change. Now, the first thing we do here is to let people know that we value reading so much. When I was living in America, the white man would tell us that if you want to hide something from the black man, put it in a book. So what I'm going to challenge us with now, who is at this book stand?
The lady.
I want to learn your personality. So you will, at your own cost. I know you may not be holding money right now, but if you have money, you can pay later, don't pay now. You can go back to where you are. You will pick a book that you fancy. Pick a book. That is your participant, and also here. You write your name down. Although you can write your name later, I expect us to be honest. Just go pick a book under 10 minutes and let us come back. I want to judge your personalities. Just let them pick a book, they will write the names. We have the next 10 minutes, please. Thank you. Read. I will not say too much about these books we have bought anymore, but at the right time, you will know why we have asked you to pick those books. I told us that change is here, and change is indeed here. One thing we must let the leaders of tomorrow know is that in everything we do, timeliness is of utmost importance. We are going to see in the course of your being here in the next 30 days that everything here is about timeliness, it's about deadlines, deadlines, and deadlines. We do not take deadlines for granted at NIPSS. It is not a military institution, but it is a place where we learn the discipline that leaders are supposed to learn. This is an immersion course. Please say to yourself, this is an immersion course. Now, next. Tell yourselves, I need to borrow a brain. I need to borrow a brain. Can you say it a third time? I need to borrow a brain. Now, where are you going to borrow the brain from? Think about it. Where are you going to borrow the brain from? I will leave that question also hanging. Now, the Director of Studies spoke to us about what brought about the PSLC course. And I want to say that for us, it is a very, very necessary intervention course that those who inspire to lead organizations, any type of organization at all, require to understand what it means to be a leader and what it means to have strategies and what it means to take decisions. You realize from this course that your decisions, whatever you choose to do whenever you become a leader, cannot be detached from who you are as a person. It is the person that makes a change. It is the person that continues the system. It is the capability of the human beings that take us to the next level. Here you will learn how to be self-responsible for your actions and how to be responsible enough to lead others. An intending leader that does not have self-discipline should not be seen to be leading others. And I want to welcome us to a place where everything from today will begin to change for you. You must have heard of a highly prestigious senior executive program that leads to the award of the MNI badge, that yellow badge that you see on very few people around Nigeria. This is not a perfect precursor course to that, but at least after 4 weeks, you know what it means to be here and to be called an MNI after 10 weeks. We are going to give you a bite of what they go through in 10 months in 4 weeks. And that is to show you that be ready for an intense time, be ready for an intense, engaging moment, and be ready to be changed, because we believe that you need to change. I welcome us to this course. You will not see me again for some time, but I hope you will work hard enough to be able to get that final handshake at the end of the 4 weeks. Unfortunately, it is not everybody that comes here that is able to get the handshake. I believe you will not fail to get the handshake. It is not going to be easy. If I'm in the business of deceiving you, I will tell you that you can take it easy, it will be easy. But the last time I told a lie was when I was a small boy and when my mom was still alive. Now, because I really do not fear anybody anymore, I can look at you in the eyes and say it is not going to be easy. So I wish us all the hardship you are going to have in the next 4 weeks. Thank you very much. Yeah. So before I formally declare PSS 45 open, let me just announce to us that we have a very strong PSSC alumni. We have a very strong body of those who have been through this course. You may have had the opportunity of meeting some of them in the past, and that for the first time, we are going to have what we call a homecoming for successful PSSC members. For those of you that will be fortunate to eventually get the handshake and the certificate, you'll be invited to the next homecoming that will happen sometimes early November. I don't know the exact date.
Creating awareness among Nigerians on government's initiatives on health and implementing a revised national health promotion policy will surely strengthen our planning and future reviews or reforms on health policies. That's about it on this beat. Thank you for joining us. I am Lydia Otidiochi. Goodbye.